This video is on the topic of breathing and people who have depersonalization disorder, but also people who have a lot of just stress and anxiety. The topic of breathing. People with depersonalization and chronic stress disorders overbreathe. They actually breathe too much. And what people often say, and what I actually used to believe, is that, well, you need to take deep diaphragmatic breaths. There's a problem with this. Part of the sympathetic nervous system, also known as the fight or flight response, also known as the stress response or the panic attack episode, occurs when your sympathetic nervous system is in a state of overarousal, and what happens is your heart rate goes up, your breathing increases, your muscles tense, and this whole mind-body explosion occurs. And what do? You breathe more. You breathe more because you're getting prepared to fight or flee from a real danger. But in the case of a panic attack, there's no danger present, and you just sit there and overbreathe. And what a lot of times happens is people are told, well, you're supposed to take a deep breath. And deep breathing can be good some of the time, but as a pattern of breathing, as a habit of breathing, it's bad. So people develop breathing pattern disorders, hyperventilation syndrome. Okay. And a lot of times this can converge with sensorimotor OCD breathing, where you're constantly thinking about your breathing because you feel out of breath because you constantly overbreathe. So what you should do is actually breathe less. One simple thing you can do is breathe through your nose. Breathe through your nostrils instead of your mouth. Okay. And another thing you can do is breathe out, then hold your breath. And there's actually a method called the Buteyko Method, which is something I stumbled upon a few months ago, several months ago. And it's where you essentially reduce your breathing by holding your breath for 5 seconds, and then breathing regularly for 20 seconds, and then holding your breath for 5 seconds, breathing regularly. And one thing they do is they'll do this thing called measuring your control pause, which is the idea you breathe out, not all your air, but you take a normal breath in, normal breath out, you hold your breath, and you set a timer, and you see how long it takes for your body to want more air. So when you start feeling the need for more oxygen, you breathe again, and that's your control pause. And you want a control pause of above 20 seconds, more than that. And generally speaking, it's important to reduce your breathing, to not breathe too much. And now I actually had singing lessons. I acquired depersonalization, and then like a year or so later, I started doing singing lessons. And one of the things you do in singing lessons is you do a lot of diaphragmatic breathing. And you actually do things like you lay down and you put a book on your stomach, and then you breathe in really deep, and you try to hold the book up while you hiss air out. And you do all these really crazy deep breathing exercises. And what happened was I developed a breathing pattern disorder from doing that, from actually doing a lot of deep diaphragmatic breathing. Okay, because I also have OCD kind of tendencies. I started obsessing about this. So I started overbreathing. When you overbreathe, you can feel tingling in the extremities or paresthesias. You can feel lightheaded. You feel out of breath. So what do? You breathe more. So you just keep breathing more and more and more, and then that can increase panic attacks. It can increase feelings of depersonalization, derealization. It's just a bad thing. So you got to start reducing your breathing. So the simple way to do is start breathing through your nose and start kind of noticing you don't really need to take in that much air if you're just sitting down. You know, you don't really need to breathe that much. And you know, a lot of people, like when you look at sensorimotor OCD, they'll say, "Oh, well, you're just supposed to sit there and think about your breathing." Because a lot of people with this, they want to distract themselves because they feel out of breath, and then when they focus on their breath, they feel more out of breath, right? So when they divert their attention, their breathing kind of becomes normal. But when they focus their attention on their breathing, then it becomes problematic because they have a breathing pattern disorder. They consciously screw with their breathing because they don't think they're breathing enough when actually they're breathing too much. Because they take these deep breaths in, they feel out of breath and go, I gotta breathe more, I gotta breathe more. And so then they feel even more out of breath. So you gotta start feeling, you gotta start breathing in less air. Okay, now if you're watching this, you see a doctor first, okay, before you try any of this stuff out. But what you can do is you can get a timer, you take a normal breath out, you hold your breath, see how long you can go before you start needing air. And it should be longer than 20 seconds, you know, unless you've just been exercising or something like that. Start breathing through your nose, and to do this, you can also do short breath pauses where you breathe in and out normally for 20 seconds and hold it for 5 seconds. Breathe in and out normally for 20 seconds and breathe out and hold it for 5 seconds. This all comes from the Buteyko Method, Buteyko method. And I think it's quite helpful. And just the general idea of you do want to breathe through your diaphragm. Okay, you don't want to be taking in chest breaths. Okay, if your shoulders are going up and you're breathing, that's not optimal. You generally want it from the diaphragm, which is a sheet of muscle below your lungs that extends downward. Your belly expands out. So they oftentimes call that belly breathing. Belly breathing, diaphragmatic breathing, same thing. So you should be breathing from that, but just kind of notice, and you can actually look at how normal people breathe. And if you realize you're breathing more than those people, you might want to reduce it. But I mean, this is only for people who really feel, if you're feeling out of breath constantly, you've already seen a doctor. Like I got a cardiopulmonary stress test done, and while I was doing it, I fell out of breath, but that showed that I was fine. So, get the testing done, go talk to a pulmonologist on that. If they say there's no organic cause, it's just anxiety, well, part of that chronic anxiety response is hyperventilation syndrome, where you're just over-breathing all the time. So you got to start reducing your breathing. Okay, so it's important. I think a lot of people depersonalization, derealization. I mean, I get this all the time. People message me with questions about this, and they complain about their breathing and things like that. So you got to start reducing your breathing. Okay, if you're worried you have a lung problem, go see a doctor first, then start reducing your breathing. Okay, and you can do this by holding your breath, breathing through your nose. And another interesting thing that this Buteyko method helped me with is that I had chronically had like one nostril clogged, and a lot of that comes from overbreathing. So one method or one technique they have is you breathe out, you hold your breath for as long as you possibly can, then you breathe normally again, and then you maybe do it again after like 30 seconds or so, and then your nostrils will clear up. And when I did this, it blew my mind that can clear my freaking nose by breathing less. That just blew me away. So yeah, it just breathing is so important. But our society tells us deep breathing. That's the thing they'll say for anyone with anxiety or a stress problem. They'll go, well, just deep breathing. It's not good advice. You need to breathe less. You need to breathe less. That's the message of this video. Hopefully that was helpful. Hopefully you can implement that. And take care.